to reintroduce to you again our host and moderator, Dr. Junaid Arshad, medical oncologist from the University of Arizona Cancer Center, who you heard from earlier. His fun fact, since you didn't get to hear a fun fact from him. Okay. He used to be a radio jockey during his medical school days. His show was called Insomnia on Wednesday nights from 12 a.m. to 1 a.m. He said his shows weren't very popular because people were probably sleeping on a weekday night. So welcome, Dr. Arshad, and thank you so much for hosting us.
So we can keep moving on with our agenda, and thank you very much, Lisa, for sharing my fun fact and then reintroducing me to the group. So our next speaker is Linda Moe. Linda Moe has been my nurse at University of Arizona Cancer Center. A lot of you have known Linda Moe working with me. She will be talking about nursing perspective on the management of neuroendocrine tumors. And as part of today's agenda, I'll be sharing her fun fact too, that in high school she was known to having the best laugh, and she still enjoys a good laugh. Many friends and family get used to her silly side and join in on the laughter. So, Linda Moe, please come to the podium.
Okay. Hi everyone, my name is Linda. I'm going to be speaking today on the nursing perspective on the management, thank you, of neuroendocrine tumors. And I am short, yes. And I only have 5 minutes, so here we go. So the agenda today, we'll be talking about pre-diagnosis to diagnosis, treatment plan, barriers to care, symptom management, patient-centered care, and then at the end I have some resources available for you. So pre-diagnosis to diagnosis, I've heard some of you say this today, but I've had patients tell me that it's taken years for them to get the diagnosis. One lady told me that they told her that she's, it's in her mind, there's nothing wrong with her. She lost her job. So it was very hard for her. And sometimes that diagnosis can take months to years. And the delay in diagnosis can lead to anxiety, depression, and even mistrust in the healthcare system. The treatment plan, once you have a definitive diagnosis, then you'll be introduced to your medical team. And most of these have been covered. You've heard the lectures from the medical doctors. In addition, I have a nurse or a medical assistant as well. And also there is an oncology nurse navigator, nutritionist, social worker. Sometimes we'll refer you to palliative care or to psychology or psychiatry. But the key takeaway point for this is just to know who your primary care doctor is. And as you see, that can be overwhelming to have so many people that are taking care of you. It's good in a way, but confusing. So ask when you go, ask who's taking care of me. So for example, if you have surgery, then talk to your surgeon if you're having pain at the surgical site. If you've been referred to a palliative care referral specialist, talk to them about pain. It's important that you stay on top of your treatment and know who to call. Also, take notes before you come to the clinic. The clinic appointment times are very short, and a lot of times there's not enough time to answer all your questions. So if you write them down, it's really good. And bring somebody with you. If they can't come in person, then they can come by telephone. Barriers to care, we know there are a lot of barriers to care. Cost is probably number one. It's very expensive. Transportation, there could be work-related issues trying to balance job and getting your treatment, and language barriers. So the key point here is just make sure we know, talk to us. Symptom management. So the symptoms will vary depending on your treatment. So for example, if you have surgery, it'll be very different than if you're having targeted treatments. And the common side effects for most treatment plans include fatigue, changes in appetite, sleep disturbances, discomfort, pain, changes in bowel patterns. But the thing that I want you to know is I want you to be familiar with your treatment plan. I talk to a lot of people and they're like, I don't know when I'm getting my chemo. I don't know what day. I don't know how long. I don't know anything. Please empower yourself to know these things. Be your own advocate. Make sure that you understand your treatment plan. Make sure that you understand the side effects. And then make sure that you report these symptoms immediately so that we can start working and helping you with these symptoms so that you don't have a delay in care. patient-centered care, this to me is the most important slide. So it's about shared decision-making. We want your care plan to be unique to your needs. We know that it's difficult. It's hard to stay on treatment. Sometimes it can be very long. And you have things coming up in your life that you want to do. You go to a wedding, take a trip. So if you let us know in advance, we can work around these things, because we want you to be able to enjoy your life as well. So people who are able to effectively communicate are more likely to continue with their treatment plans. Those symptoms that we talked about can be reduced, and it increases patient satisfaction. So the key point here is it's all about you. And these are the resources. There's a QC code that you can use that's for NCCN guidelines for the entire latest one for patient guides, and then also the resources there. If you can't get that, you can just take a picture of that. So thank you very much. Did I do it? Less than 5?